मैं हो जाता हूँ।
Good afternoon, everyone. Welcome to the live session of Raj Hospitals. I am Tushar Ujjwal. So today we are going to talk about the topic that is osteoarthritis and total knee replacement. So आज हमारे साथ डॉक्टर सिन्हा, डॉक्टर उज्जवल सिन्हा, ऑर्थोपेडिक सर्जन इन राज हॉस्पिटल. He has MBBS, DNB, MNAMB, AMS, and also he has fellowship in sports medicine and joint replacement from Singapore. So मेरा first question आपसे सर ये है कि can someone still have osteoarthritis after knee replacement?
See, let me brief you something about the osteoarthritis first. See, am I audible to you all?
Yes, sir.
Right. So, osteoarthritis is what we are talking mainly here is senile osteoarthritis, where it's a degenerative kind of disease where you and we are talking on the only about the knee joint. Fine. So, with weight bearing and all, as I said, it's a senile kind of osteoarthritis. With age and as the time passes, and the cartilage itself it burns off. So here we are what we do. I mean, in a general, layman term, what we do, we just do capping of those exposed bones. Earlier it was covered with cartilage. Now we are replacing this cartilage with metal, and so that is what the knee replacement is. But it is in the general term. But osteoarthritis and the knee replacement, it's not only about just replacing the articulating surface. If honestly speaking, it's a soft tissue operation. I mean, the soft tissue balancing. If one is able to do the soft tissue balancing well, the results are good. If someone is, erring in doing that balancing, the results are compromised. So once the PKR is done, then I don't think so. I mean, that any osteoarthritis will be left. I think my explanation itself, gives a brief idea to the audience that it's already. I mean, if once the PKR is done, there is no osteoarthritis now. Now it is either it is implant failure or it is, poorly balanced knee. Is it fine? Yeah.
Yeah. So what are the factors that increase the risk of osteoarthritis?
What kind of factors?
Yeah.
See, there are a lot of things which play a role in early osteoarthritis. So, as I said, we are talking here about the knee, only about the knee. So, the most common, what I will say, is senile osteoarthritis. Senile osteoarthritis is because of aging. Second one is because of obesity. If a person is obese and the knees are, overloaded, then also. Third one is traumatic. Traumatic in the sense, suppose someone has intra-articular fracture and which was, managed conservatively or operatively, whatever the, however it has been operated, however it has been treated, doesn't matter. But if there is some incongruity between inside the joint, that knee also results in early osteoarthritis. Fourth one can be any kind of tumor, can be any kind of infection. These all can lead to, these are the tumor is obviously the rare cause. Infections, suppose someone is having tubercular knee or someone had some pyogenic infection in the knee. Then also, I mean, the knee go for early degenerative changes and the cartilage won't form. So these are, and again, the sports person, sports person who are having recurrent, trivial or the trivial episodes or the, recurrent trauma to the knee because of, their actions and any kind of fall or anything. So those knees also go for early osteoarthritis. And again, as I am a sports surgeon too, I will emphasize on it that any ligament injuries, any ACL, PCL, anterior cruciate or posterior cruciate ligament, these are the ligaments which are inside the joint, which allows or which conforms the normal anatomical range of motion of the knee. If these are injured, such knees, even if they are they have been reconstructed, such knees also go for early degenerative osteoarthritis. So that is it.
All right. So, can osteoarthritis be cured?
Yeah. See, it's a very difficult question. So, cure in the sense like at what stage you are presenting to your doctor, right?
Right.
Not for every osteoarthritis, TKR is the answer, right? If a patient is like my like when I see in my OPD any cases of osteoarthritis, severe osteoarthritis, my first question is, can you walk for 500 meters independently? And or if he says, yeah, I can. If I and then I ask him like, if you have, the maximum how much you can walk. If the patient tells me that he can walk independently between 500 to 1 kilometer, independently without any support, without sitting. But obviously, if and even if the X-ray says that the knee is bad, I don't touch those patients, not at all. So it all depends upon the, just seeing the X-ray and telling that fine, it's a grade one, grade two, grade three, grade four like, type of. So this will be this osteoarthritis will require knee replacement. This won't require. That will be again. It's a very subjective kind of evaluation, right? So if someone is having bad osteoarthritic knee, but he is able to walk and he is able to do all his activities without any support, so such patients don't require any kind of operation, nothing. And in early phase of osteoarthritis, what we recommend and which is the most helpful is physiotherapy. I mean, as if you do a good static quadricep exercises and if your muscles around the knee are strong. So the basic funda is if you are keeping your muscles healthy, even if with a bad joint, the pain reduces a lot because it is commonly said that the venous congestion, it decongests the venous congestion and the pain reduces. So that is what we are aiming for. So in the early phases, if you are doing good physiotherapy, good muscle strengthening exercises, then obviously it cannot be cured, but it can your original knees, the longevity of your original knee can certainly be extended, and the knee replacement what you will what otherwise you would have required in next 3 years, that will be extended to another 4 5 years more. So because if you are replacing anything, that will last for 15 years, 17 years, 20 years, even with, these are the data. After that, you will have to revise it. So why not to extend your original knee? So in the question, as your question is, can it be cured? So yeah, if we are taking it as a like a painless or a functional knee, then yes, it can be in that term. It can be cured in the early phases with physiotherapy and some medications. Like there are some medications in the market, right? Chondroitin sulfate and all. They somehow these all new drugs has came up. I don't believe much on them, but yes, I say ki fine. They reduce somewhat of inflammation, so the patient have some relief. But yes, the physiotherapy will help them. And in the last stage, once the patient is like tired of all these symptoms, then obviously with knee replacement, it can be with can be the treatment of choice for the selected patients, not every patient. Yeah.
All right. What are the possibility complications that one might face after knee replacement surgery?
See, there can be as I say, I always select my patients. See, the patient selection is very important when you are doing a knee replacement. A fragile kind of like a old man with no muscle mass and no willingness for the operation, and who is not ready to do his physiotherapy after the operation, who is not ready to take care of his muscles around the knee after the operation. Because see, it's a soft tissue balancing operation rather than replacing the bone. So those patients, obviously, I'm talking about the most common complications. This is one of the complications. Those patients, they land up with stiff knee and limited range of motion. I will consider it as the first complication of knee replacement. So always we always choose our patients smartly, and we always say that the post-operative period is as important as the intraoperative. Post-operative physiotherapy is the must. So this is one of the most common complication, and the second one, the most dreaded complication, is again the infection. It's a nightmare for the surgeon. It's a nightmare for the patient, uh, and obviously the relatives too. So uh, this can be. Already these patients, they sometimes come to us because if they are coming from the distant places, initially what people do, they keep on injecting the steroids inside the joint, and whether you are aware, you are not aware, the surgeon is aware or not aware, the moment he opens up the local, the inflammatory response of those tissues where the steroid has been injected, it's certainly reduced. So you do a operation, you come out well, you did your balancing well, you stitched it well, and everything came out well. But in the third post-op day, what do you see? There is some discharge. So, with steroid injections, even sometimes the sterility inside the operation theater, because it's a team job, right? Sterility inside the operation theater is breached somewhat. That can also lead to the infection. Sometimes, even if a patient is having some toothache, which he has not mentioned or the doctor had missed, in such cases too, if there is some infection inside the tooth, that can go hematogenous with hematogenous route with the blood inside. And recently he has been operated. That can go to the joint, and that can infect any kind of wound, any kind of abrasion, any anywhere in the body which can be a potential source of infection must be avoided. So this is the second most dreaded complication. There can be other complications if the post-operative fractures in the knee, in the operated knee, because you hammer it, you do it. Hammer the femur, hammer the tibia, and the fracture can happen intraoperatively, or even in post-operatively. Patient can have deep vein thrombosis, and it's again a very dreaded complication. You have done everything well, but there is some thrombus in the calf region or anywhere else which went into the lungs, and you are losing your patient. So these all are the complications. So, but there are positive side also. So I will say I mean, if the patient is properly evaluated and post-operative protocol has been followed, such such incidents can be avoided. Right.
Okay. So our next question is like, can a person who have undergone PKR, the knee replacement surgery replacement, can perform an active lifestyle, or do they have to take some precautions?
Yeah, certainly yes. They can perform a very active lifestyle, provided they are doing a good physiotherapy and they have built up their muscles around the knee. So see earlier what we had, they had some limitations that I mean the flexion we could not achieve the full flexion. Now there are high flex knees. Such contouring has been done and some designs has been changed, and now we have the high flex knees. So obviously the patient will have 0 to 120 degrees of the range of motion. He can sit comfortably, he can walk comfortably. So a properly done knee in a properly selected patient with a patient who is willing to do the physiotherapy and who has the zeal to achieve a good strong knee. Certainly he can go forward with a very active lifestyle. Right.
Uh, so the last question, that is, what are the dangers of delaying knee surgery?
Dangers, see, a mobile, always a ambulatory or mobile patient. Recently, I had a patient with she had a uh, she was. I have advised her to go for knee replacement 2 years before, and that time the family refused me a lot of those talks that I have seen his replacement, I have seen this replacement which has been failed, the patient could not walk and all. I mean, okay, fine, there are patients after the replacement. As I said, there are a lot of factors which a good result depends on a lot of factors. So, but they did not listen to me and they refused the surgery. I got a call from my colleague, a nephrologist, that doctor, your patient is admitted under me, so can you have a look? I said okay, fine, I'll come, I'll see. I went to the ward, I have seen the patient, and what she did, yeah, for the obviously if it's a bad knee and if you have been advised for knee replacement, obviously you will have certainly you had the pain, that's why you consulted an orthopedic surgeon and you did not follow the advice. So she kept on popping the analgesics, painkillers, which is readily available in all the medical counters. There is no such regulations that which can prohibit such a free sale of these analgesics, which are the problem of so many diseases in India. She kept on popping that. Apart from that, she kept on popping the steroids too. So knee replacement pain, knee pain was little reduced, but her kidneys, she landed up in chronic renal failure. She landed up in peptic ulcer. So delaying those surgeries obviously will lead to such things. Obviously, and if okay, fine, someone is aware of all these things and he somehow she has not or he has not taken these things, those patients, they limit their daily activity. They in the and again in the old age, most of the elderly people, they are diabetic, as we are the diabetic capital of the world. Most of these elderly people are diabetic and hypertensive. So the physician always says that you have to take a walk for 2 kilometers, and again it's a vicious cycle. Your knees are not your knees are not helping you, and you can't walk, and your sugars are not controlled, your BP is not controlled. And the third thing, what I see in these patients, slowly they lose the zeal of, living. They just get depressed and all. So these are the things, and the overall health that deteriorates a lot. And again, a healthy patient, ambulatory patient who doesn't have any problem in, walking or running or walking fast, those patients obviously they do better than those elderly patients who have limited their life to their just household chores. So these are the what I said, disadvantages of not going for knee replacement or something, or delaying the treatment for osteoarthritis. Right.
All right. So, anyone wants, they can ask in the comment section their question.
Sorry, I can't hear you.
Hello, am I audible? So, thank you so much, sir, for joining us today, and also all the viewers who are with us today. I hope this session is very informative to all of our viewers. So, we will be back with another session next week with some another topic. So, till then, all right, sir.
Mm. If there is any question, anything from the people whosoever are watching it, then I will be happy to
No,
answer.
sir, we don't receive any questions from the audience yet.
Yeah, fine, that's fine.